One of our guest speakers this evening is Claire Foley, Chair of New York City DSA Healthcare Working Group. New York City DSA Healthcare Working Group is currently working to pass the New York Health Act and establish a single-payer healthcare system in New York State before the close of the legislative session on June 10th. She lives in Brooklyn and has been a member of New York City DSA since 2018. Thank you for joining us.
Well, so am I. I'm really happy to hear about what you have all been working on with this. I think I mentioned to Siobhan in my email that I'm the chair of the New York City Healthcare Working Group right now. I'm also the regional organizer for the national campaign for most of New England. So for both these reasons, I'm really excited to hear what you're working on, and I really want to figure out how we can work together to make both of our campaigns more effective. So I don't have any slides, unfortunately. I'm sorry about that, but I'm happy to share notes after I finish talking, and then we move into Q&A, right? So it looks like there's about 20 minutes on the agenda, right? Yeah, okay. So I'll see how long it takes to say the things I have to say, and then we can see if there are any questions. So basically, yeah, I mean, I'm planning to talk about a little bit about how we might take, these state-based bills because New York City and New York State in general, DSA groups and our coalition partners are working on a state-based single-payer bill, the New York Health Act, that has a long history, going back a couple decades. But we're at a point right now where, the prospects for passing this bill have never been better. We came into this session with majority co-sponsorship in the Senate and the Assembly, both houses, and since then we've been able to get more legislators on board with the bill. So at this point, we're looking to a June 10th end for our session. And the bill is making progress through committees. We're trying to ramp up the pressure from the outside while also working with legislators. And at the same time, within our group, and especially within sort of the research side of the New York City DSA Healthcare Working Group, thinking about what could amount to a much, well, not longer, but a complicated fight for implementation that we don't necessarily understand all the elements of right now. And that would be kind of our next big challenge, were we to successfully pass the New York Health Act. So I thought this was a great opportunity to think through a little bit of that. It's something I've been thinking about even as we're running a lot of, just the basics of the campaign to actually get the bill passed. And thinking about especially, the Canada model, because when we talk about state-based single payer as a strategy in the United States, what often gets brought up is the fact that Canada is sort of this big example of a country that enacted a universal healthcare program with in this sort of province by province way. They started in around 1947, I believe, in Saskatchewan, moving through the next few decades to expand, what was required to be provided, how many costs were covered by the federal government, the provincial government versus patients, to 1984, where this sort of system of, universal healthcare provided by provinces in accordance with requirements of the federal government, with requirements for funding those provincial healthcare systems determined by you can get this money if you provide a certain kind of universal care at the provincial level. So that's kind of what we're always talking about when we're talking about how does state-based single payer work as a path to national Medicare for all. And when you're really thinking about kind of the nuts and bolts of it, I mean, I think there's also floating around like a more general argument that enacting a successful, proven sort of single payer system in the United States would allow for people to understand that it can work, and perhaps like lead to a more traditional path of like passing the federal level Medicare for all bill. But these are just kind of different ways that it's talked about. So uh, another question, I'm thinking about here is, what does it look like to start with one state and move to a national system in terms of how can like other states and how can people working for a national Medicare for all program learn from the experience of a state that, enacts single payer first for itself. And this is something we've been thinking about because, we're not the first state to try to pass single payer. We won't be the first state if we do pass the New York Health Act to approve a single payer program. And, what we're looking at is the things that are the reasons that, Vermont or California hasn't been able to successfully implement these programs. And so, a couple of the big things that come up are resistance from the health insurance industry, and resistance from legislators themselves, and then other things as well, which is that as you're looking at what it would take to implement a successful single payer program that doesn't doesn't sort of, I don't know how to phrase this. So it's like, there are all these different ways that people who oppose single payer healthcare talk about why it's bad, right? Wait times, inefficiency, you can't choose your doctor, all this stuff. So, all of this is just kind of scaremongering. We have all the information that shows that, this would lead to better outcomes for, the majority of patients, and be cheaper. And I don't have to sell single payer to you, but one thing we're thinking about in New York is that there have to be enough health places where people can access healthcare at the time that we pass the single payer program, so that we're not in a situation where existing inequalities and issues with our healthcare system sort of make it seem as if we've created a worse system by switching to a single payer program. So one way we're addressing this in New York is we're very involved in the fight against public hospital closures in New York City, which has affected, I think, about 20 public hospitals in recent decades, which take on patients who don't have insurance, who are on Medicare, Medicaid, who aren't profitable for the private hospitals in the city, and most of these are in neighborhoods that were disproportionately affected by COVID. So this is just kind of one way we're thinking about, how sort of this central task we have of passing single payer, leads to all these other questions of how can we make sure that in the event of like a rollout, we have kind of a system that can work and can in sort of the foreseeable future provide demonstrably better outcomes. So all this is to say that like the ways that like New York passing single payer can make it easier for other places to pass single payer are also the challenges to New York successfully implementing single payer. The other thing I would say, which I mentioned a little bit, is that if New York passes a single payer bill, it's going to become the focus of resistance from the health insurance industry and other key points of resistance like the American Medical Association. And so on the one hand, it's like, if even so we're able to implement this a system, that means that there's precedent, there's kind of like a developed network of activists, there's there's proof that this can work for patients. But at the same time, it's like thinking about how a hugely powerful national industry will respond to like an existential threat to its profits is as a single payer activist in New York, something I lose a lot of sleep over. So yeah, I mean, those are kind of my thoughts there. I know there was also a question about how we collaborate with the Campaign for New York Health, which is one of our main coalition partners as DSA for Medicare for All in New York State. So I mean, this has been a long time collaboration over the New York Health Act. The basic division has tended to be that they are working more with legislators while we're doing more of the sort of external organizing. Although I would say that, and I maybe should have mentioned this earlier, that now that New York City DSA has a slate of state level legislators, we've become more involved in sort of the conversations in Albany that are happening around this bill and around other bills. And in general, sort of stepped up our involvement in directly working with legislators as well as organizing public pressure for our various campaigns. So yeah, I mean, that's the general distinction, but in the day-to-day, we work very closely together on things like social media for our various events. We're co-sponsoring regular bi-weekly phone banks to target legislators for the New York Health Act. We collaborate on strategy, thinking about who to target when, and we, and yeah, okay, I think that was my last point. So this is just, that's just kind of an overview of how we work with them. They're not, our only coalition partner. We have many others, both, other DSA chapters across the state, and then other groups such as Physicians for a National Health Program and New York Progressive Action Network. So we have kind of, we have our sort of New York City-based campaign, and then also a more robust, like statewide campaign that we're working to get off the ground as we move toward June 10th and hopefully getting a vote on this bill. So I'm going to stop there for now. I'm not sure how long that was, but I would love to hear any of your questions, comments, how any of this might be useful to you in Connecticut. And actually, I'm sorry, one more thing I will say is that one thing I think is really important about with this is, like, if you're working on federal level Medicare for all, if you're working on state level Medicare for all, one thing we can do right now is figure out ways that activists in states where there are not necessarily, robust state level single payer campaigns, but who want to work on that, or even if there are, but you want to work on sort of these later questions of implementation and how it all works. I think there are a lot of opportunities for that, and that's one thing that we've been doing that I'm really excited about. There are efforts, for example, to develop messaging around why, ERISA, this law about companies being able to provide insurance for their employees, why that's not sort of a fatal flaw in single payer in the United States. There are efforts to streamline, federal funding for state-based single payer. So I think, this is a really important moment for us to be thinking about, thinking creatively and thinking expansively about how to move forward on this issue, even if we're not necessarily pushing for, a state-based single payer program. So any thoughts about that, I'd love to hear as well. Thank you all.
Thank you so much, Emma.